We have been reporting on the severe flu outbreak around the country. Here is one example of the toll it's taking. Health officials in Illinois report nearly 150 flu patients have been put in intensive care, and at least 6 have died.
Dr. LaPook is here to help you recognize flu symptoms and explain how to avoid the flu. All right, doctor, first, why is this year is it so severe?
Well, it's really come earlier. It's about 5 weeks earlier, but it's not more severe than typical. Now, the CDC wants you to be concerned because every year you can have tens of thousands of deaths, and there's a very good vaccine out this year, and they want people to take it. That's the best way of protecting yourself.
It's never too late.
It's never too late. It only takes about 2 weeks for the vaccine to kick in. Now, we're seeing a lot of flu right now, but the flu season can extend actually as late as April, even May.
And what's the difference in a cold and a flu?
There's a lot of overlap. I mean, in general, the cold is from the neck up. You have sneezing, runny nose, the cough. But you can see some cough and sore throat with the flu. But with the flu, you tend to be just really sick. Fever, headache, aches and pains. Have you ever had the flu?
I can't remember, no.
It's maybe because you had the flu. I mean, when you have the flu,
right.
You're just out of it. It's terrible.
So you say it's not more severe this year, but then why are we seeing, like all these hospitals in Chicago turning away ambulances because they're overrun? We've seen in Pennsylvania, we have pictures of tents outside of the hospitals to deal with the overflow. I mean, this is unusual to see this kind of stuff.
Well, it's troubling to see it, but it's actually not particularly unusual. This year, there's a strain, H3N2, which in past years has been particularly nasty. So they are concerned, and they do want people to get vaccinated. But every year, and it is very disturbing, if you get the flu and you're in an intensive care unit, you can die. So the CDC wants you to get vaccinated.
What types of people are most at risk?
Well, they're recommending this. Everybody over the age of 6 months get it, unless there's a reason not to, like an allergy.
Everybody over 6 months.
Everybody over 6 months. That's
about everybody.
99% of Americans, and especially people with underlying medical problems and pregnant women.
Gail is scared of shots. Would you be willing to help her out?
Inject
hold her hand?
her.
Inject her.
I would be willing to inject her, and if she really doesn't want to get it, there's a nasal mist.